I've seen some numbers from the Australian government that suggests that around 19,000 nurses over the past 2 years who are registered in New Zealand have registered to work in Australia.
What we saw last year, right, was our graduating cohort of nurses who just finished their state exams, qualified after their degree, gone through that process of unpaid placements. 50% of them didn't get a job at the end of them graduating. And so what they were saying as well is, I have no choice but to go to Australia because I can't be employed here. And I can't help but think that when you think about when those students entered study, right, in that kind of peak COVID period, nurses are heroes, nurses are essential workers, we value nurses, we clap for them in the street. And then by the time they finished the degree, there's too many nurses, we don't have a job for you, and we're not prepared to provide you safe working conditions or pay you fairly. And so there's this real kind of whiplash moment in how we value our health workers and value our nurses that I think is only putting them on a plane to Australia.
Kia ora koutou, and a warm welcome to episode 14 of Locked Out with Craig Rennie. By day, I'm the economist and director of policy for the New Zealand Council of Trade Unions. But by night, this podcast looks at the numbers in New Zealand and asks the hard questions so that you can too. We hope that you're enjoying the show and what we do at Locked Out. If you like the analysis that you hear in the show and think that others would too, then recommend us to your friends or even your enemies. Also, give us a recommendation wherever you get your podcasts. It really helps get the word out. Here at Locked Out, we're always really interested in what our viewers and listeners want to know. If it's making you ask, did that really happen? You can be in no doubt we're asking it too. So get in touch. I'm on X, Blue Sky, and on Substack. We want to hear how we can help you better understand what's going on and how you can help navigate the numbers being thrown around by politicians and experts alike. Now, we're very fortunate on the show today to have my colleague Nathalie Jaques, who's a strategic researcher from the New Zealand Nurses Organisation. Now, the nurses have recently voted to take industrial action to help advance their pay claim, to help change terms and conditions in their sector. And we've brought Nathalie on because there's been a number of what could only be described as half-truths that have been put out by the Minister of Health. And we want to give NZNO an opportunity to talk to you about what's really going on in the health service. We've known for years that the health service has been chronically underfunded. Despite big uplifts during the past government, we've seen over the past 2 years, health funding hasn't kept up with inflation or with the cost of living or with population change. We've also seen lots of new activities being forced onto the health service, but not necessarily lots of new amounts of money to help actually deliver those services. That's put real pressure on nurses and other medical professionals. And we want to ask Nathalie what's happening as a consequence and what difference it's making. We also want to ask Nathalie what's been the impact of the loss of pay equity for nurses and what's happening to nurses in terms of the number of them who are now heading overseas. Let's speak to Nathalie now. Nathalie, thank you so much for joining us here on Locked Out. First things first, can you talk us through a little bit about the financial background to health at the moment, financial health services? What's really going on and what's really happened at the last budget?
Well, we know that health has been chronically underfunded for a really long time. We spend about $29 billion a year on health services in Aotearoa. But what we've seen over the last few years, the particularly compounding shortfall in what is actually required to meet patient need rather than the sort of budgets that are set up as estimates above that. And I think a really good example of this as it relates to nursing in the last few years is in the quarterly report from Te Whatuora in March 2024, they claimed they were 2,089 nursing FTE ahead of budget, right? So we had 2,000 too many nurses. But then at the same time, we're seeing chronic understaffing in the data in our hospital system in terms of what's actually required to meet patient needs. So there's this tension there where we're saying we're over budget, But we've also got all of these kind of evidence of understaffing and unmet need in the health system as well. So I think this is kind of really where that tension is health a cost to be capped or a need to be met?
So very quickly, Nathalie, that makes it suggest like someone has deliberately under budgeted for the number of nurses that we actually need in the country. Is that a fair assessment of what's actually happening?
Absolutely. That's absolutely what I think is happening. And then so where we're seeing, for example, in the last budget, we had $1.37 billion allocated for uplift for health services. But at the same time, and what was largely attributed to that overspend on nursing FTE, there's the directive from Te Whatu Ora across all health services to be cutting back at the same time, right? So last year, the goal was to cut $660 million out of health spending. And this is in order to come back into baseline or allow the health system to live within its means. It's the kind of quote du jour. And so last year we cut $660 million with the claim that wouldn't impact frontline services. So that looks like 1,500 roles cut from data and digital services. It looks like administrative cuts, getting rid of the procurement team, things like this. So this is the fat that was identified to be trimmed. And then this year the plan was to cut a further $900 million from health spending. And a recent Treasury report identified that because the current Minister of Health, Simeon, is adding more initiatives, more things for the health system to do without the money to go alongside it, they need to reprioritize further spending within the health system, which is, another word for cuts, rob Peter to pay Paul. And so that's projected to probably be about $1.3 billion in cuts this financial year. So we're putting $1.37 billion in and taking $1.3 billion out. So we're really standing still while we're seeing growing levels of unmet health need and high levels of acuity in the patient population, aging population, greater levels of comorbidities, and also a really burnt out workforce that have just been white knuckling it for years to continue to provide care for their patients. So that's sort of the financial underpinning of what's happening.
Crikey. So essentially we're putting $1.36 billion of new money into health, and that's to pay for everything. Yeah, that's to pay to keep the lights on. That's to pay for all the new drugs and everything else. Yeah, but we also need to save at the same time $1.3 billion of money just to stand still. So that sounds as if we're essentially putting no new money into the system, or the government has chosen to deliberately underfund health, knowing that's the case, and are forcing the system to generate savings up to the level of deliberate underfunding. Is that fair?
Yeah, absolutely. So
what sort of problems is that sort of creating for your members right now in the health system?
So starting, I suppose, just with the hospital sector, but yeah, this is an all of health problem. And because as well, there's this kind of preoccupation with where it's most visible to see unmet need, which often is emergency departments, right? That's where kind of there's a lot of focus. But that actually comes out of a much bigger story across all of health, where, for example, when people can't access primary care because of the cost to the user pays costs to see their GP, for example, or the lengthy wait times, or whether or not it's not being able to be seen by a school nurse, then you have higher levels of need presenting in emergency departments, and sort of also those lengthy wait lists and things. So there's stress for patients in terms of accessing care. And there's also stress for the nurses and the kaiawhina in terms of delivering it in those really stretched conditions. And so what we're seeing with this chronic understaffing in particular is that there's high levels of stress and burnout, high levels of turnover in lots of parts of the health system. And it's particularly acute in certain specializations. So mental health, for example, we have some mental health wards that are recorded as being understaffed 99% of the time. We know that last year, between January and November, 50% of day shifts we're understaffed in our public hospitals. So that means, every second day that you're going to work, you're working in an understaffed hospital ward. And we know that when there are understaffing in our hospital wards, then that impacts patients in terms of worse outcomes, increased infections. It means they're more likely to have to be readmitted, longer hospital stays, which is also more expensive. So we have this kind of compounding impact on the workers, on the patients, and on the overall functionality of the health system. I think,
crikey, I have the next question I have written down, Nathalie, is the nurses have recently decided to take industrial action in New Zealand. I'm half tempted after that answer to ask why you haven't been on industrial action since forever, if this is the case. But can you tell us right now why nurses in New Zealand have decided to take industrial action, and sort of what's prompted this particular outcome?
Mm-hmm. So the primary motivation for our members is safe staffing. This is the kind of key issue, really. There's the aspect of pay as well, but the headline is that we do not have sufficient numbers of nurses to provide clinically safe, culturally safe care to the patients who need it, when they need it, where they need it. And so one of the claims that our members have had was to try to work collaboratively with Te Whatu Ora to look at new ways to ensure safe staffing. And we've now, through government intervention, the place that we got to in that negotiation where there was agreement about working together moving forward to explore that issue was removed. So we've gone backwards on the staffing issue. And similarly, the claim for pay is around, a cost of living increase for these health workers. And so 3% is kind of below that cost of living increase as well. So that's a factor. But the primary motivation is definitely about securing safe staffing for patients.
Now, if we talk about pay, because as you say, you've been offered 3%, but it's important for our listeners and viewers to note that's 3% over 2 years. That's not just 3% in 1 year. So inflation
slightly over 2 years, 27 months.
Yeah. So inflation right now is 2.5%. It's likely to be somewhere near that in the next year. So that would be over 2 years, 5%. If you got a 3% pay rise, you're essentially taking a 2% real terms pay cut by the end of that forecast period. So if you had someone who was on, just for ease of maths, $100,000, by the end of the pay period, they're $2,000 worse off than they were at the beginning, or around $40 a week worse off. Is that what's being put on the table, or is there something else which we're missing, which the Ministry of Health has said, here's something that's going to really help you, or are they really standing to those particular numbers?
They're definitely standing to those particular numbers, and that point that I just made about extending the term 27 months was another way that they've clawed that back a little bit, so that 3% actually goes,
even further,
a little less further for them. I guess the other thing as well is that we're exiting this particularly high level of inflation over the past few years, and these negotiations have been taking place through 2024 as well. So we're also sort of backdating those things to deal with that level of inflation in the past. So it's not just kind of the current picture, it's what's happened since they were last in bargaining as well.
You're absolutely right. Now, the Minister of Health has made a number of what can only be described as fairly inflammatory comments about nurses' pay in light of the decision of NZNO to take industrial action. He has, for example, claimed that the average pay of a nurse is now around $125,000. What is that right? If it's not right, what's the right number? And three, is there anything else that he said that you sort of want to sort of be able to sort of clear the air about in terms of his comments?
Absolutely. It's really unclear to us where the numbers have come from and how they've been arrived at. A lot of our members have a sort of knee-jerk reaction that if that's what they were paid, there would be no dispute over pay. Then what we would be interested to see is the workings, I suppose, that the minister is using to come to this, because we know, and the nursing pay agreement is freely available online for anybody to look at, including the minister, and we'd invite him to read it thoroughly. The Step 7 nurse, which is the top of the pay scale, the top of the kind of qualification scale for a nurse. So basically a nurse who has 7 years experience in the health system in Aotearoa would be presumably on that level. So it's the vast majority of nurses, right? They've worked for at least 7 years. Their pay is about $106,000 as a base rate per year. So for it to be the case that a full-time nurse is earning $125,000, as the minister has claimed, this means they're making an extra $18,900 in a year through additional allowances and penal rates. So some nurses, if in the hospitals you're a shift worker, often you've got, changing roster. So you might be working nights, you might be working weekends, you might be working public holidays. The health system doesn't close down for the day. Then though they're compensated for that, for doing shift work, which can often be really difficult and burdensome, particularly if you've got family obligations, ability to participate in community events. So those things are fairly compensated for. So that's one thing. What we're saying is that if that was the average pay for these very experienced nurses, that's a 17.7% increase above their base rate. So they would need to be, if this was a Step 7 nurse who doesn't work nights and weekends, for example, which might be the case, if you're in an outpatient clinic or a day stay unit, something particularly if you're not doing acute admissions on the weekend or at night, which is a lot of hospital wards, they would need to work 247 hours overtime in order to get that. So that's the equivalent of 6 weeks of full-time work. And going back to the point about safe staffing, yes, they're being compensated if this is the case, that there are this many nurses earning this much, but also that's an unreasonable burden of overtime. They don't want to be doing it. That's why we want the baseline safe staffing fixed, so that you're not asked to do, your 40 weeks a year plus an extra 6 because there's not enough of you. But the other thing is many nurses don't work full time. Many nurses, aren't working weekends, aren't working nights. And so this definitely isn't representative of the full picture. The other thing we know about those numbers that they've used senior nurses and all of those kind of allowances and penal rates in them. There are very few, nurses working at that really, really senior level, earning those particularly high rates. But also, we know that they've got, a significant level of responsibility within the health system and are fairly compensated also for that level of delegation and responsibility in delivering health services. So really what we would want to see the minister front on is, what is the average take-home pay, the median take-home pay, so the genuine midpoint for nurses who are, registered nurses in the health system, and then separately within the senior nurses. And I think that will give a much more honest picture of what the realities of nursing pay are on the ground.
Can I just pick up on that word honest? Because it seems to me, naively perhaps, a deliberately dishonest position to take, to say that nurses on average are paid $125,000 a year, and to pick that number to help, simply spark some sympathy with the government ahead of a pay dispute. It seems to me that this is a very political decision by the Minister of Health, rather than something that's helping to inject knowledge or information into the public domain. Now, the Minister of Health has also said that the decision to go on strike by NZNO is a political decision. Is that something you want to comment on? Because, it seems to me most people don't go on strike for political reasons. They go on strike for pay and condition reasons. Is what's going on with nurses in this area?
I think the implication from the minister seems to be that nurses are overpaid. And that there's this attempt to kind of have outrage at this level. But as I said, it's very clear what the base rates for nurses are, and the level of kind of responsibility and value that they contribute to the health system, particularly when it's been so underfunded, understretched. Members are going on strike and not taking that lightly. And as I said, it's about safe staffing. It's about the prioritization of patient safety, cultural safety, clinical safety. And so this is kind of the aim to come back to the table and seriously negotiate on what we're going to do about staffing in the health system, with the commitment to resource and fund that. Because what we have currently is a program called Care and Capacity Demand Management, CCDM. And what this basically does is look at the supply of nursing workforce you have, and then the patient acuity, or the demand, the need for it. And it will tell you whether or not you have enough workers to enough sort of clinical capacity to service people who are in the wards, right? So if we're saying on one hand, and we've had these claims that, there's been, 2,079 nursing FTE ahead of budget last year. Lester Levy made claims that there were pauses on, nurse recruitment because of the 3,000 nurses beyond Te Whatu Ora's budgeted numbers, and Simeon Brown and data released last week from Te Whatu Ora also claimed there'd been 2,100 nurses employed since September 2023 to March 2025. And so what you would expect then, if there's all of these new nurses, there should be all of this capacity. We shouldn't be seeing that level of unmet need, of a lack of capacity to service the actual patient need on the wards. Whereas what we know as well is between January and November last year, there was a maximum of 665 FTE short across 16 health districts. So we were 665 nurses short in one shift, right? The average is 433. So every shift in that period last year, we were short about 433 nurses, right? So this is compounding every day, every shift. At the same time that we're being told there's up to, between 2,000 and 3,000 more nurses than have been budgeted for. So you shouldn't be seeing this level of chronic and persistent understaffing, which actually tracks with the 2022, 2023 numbers. So it's not a case that it was even worse before and then we recruited some and now it's less bad. It's consistent levels of understaffing across that period.
So can I just talk to you very briefly about a couple of other things? We've seen a number of other decisions with regards to female-dominated workforces across the country. Pay equity has been lost. Pay equity has been lost for nurses. How is that likely to have an impact on the workforce?
So when the pay equity legislation was extinguished, the NZNO Tōpu Tangatapu Kaitiaki Aotearoa had 12 live pay equity claims and one review process for the settled Te Whatu Ora agreement. So basically of the 33 claims, NZNO was had either directly raised or was party to 13. So it's significantly impacting our nursing workforce. So Te Whatu Ora nurses voted to accept their pay equity settlement on the 31st of July 2023. And so for a Step 7 nurse, that amounted to a 25.8% pay increase, right? And one of the things that's really important to understand about pay equity is it's not a normal pay increase, right? It's a historical correction for sex-based discrimination in your pay. So what that means is that those nurses were underpaid by 25.8%, and that was corrected, right? So when we kind of get that claim of the significant levels of nursing pay increases in the last 10 years, which was another number that the minister was citing, a large amount of that was a correction to historical sex-based discrimination that the pay equity legislation sought to correct. So we have 12 claims across different parts of the health sector, so aged care nurses, the care and support claim, Plunkett, sexual wellbeing, GP practices, right? Nurses in every pocket of the community across the health system who have now been set back, basically. The other one as it relates to Te Whatu Ora, so the legislation allowed for a review process every 3 years so that basically you wouldn't allow for discrimination to creep back in. And that review process had been initiated for our Te Whatu Ora nurses and was again annihilated by the government's changes to legislation. So those Te Whatu Ora nurses are now only able to re-raise the claim 10 years after it was originally settled. So that'll be 2033. So they've lost that mechanism to ensure that sex-based discrimination doesn't creep back in to their remuneration rates.
And so what practical, I've seen some numbers from the Australian government that suggests that around 19,000 nurses over the past 2 years who are registered in New Zealand have registered to work in Australia. We can't continue to essentially be the training school for Australia in terms of nursing. What are you seeing? What's NZNO seeing in terms of the number of nurses who are leaving the country or looking overseas because of the pay terms and conditions that are both better overseas, but also the kind of environment that they're working in New Zealand?
Absolutely. And it's definitely something that we hear from our members a lot about the intention to leave. So I think there's several aspects. One is the improved paying conditions. Australia also has mandated minimum staffing levels in the form of ratios. So there's those kind of guarantees that you're going to have safer and enforceable staffing levels within different parts of the health sector. I think in terms of training our workforce to leave is a really good point, because what we saw last year, right, was our graduating cohort of nurses who just finished their state exams, qualified after their degree, gone through that process of unpaid placements. 50% of them didn't get a job at the end of them graduating. And so what they were saying as well is, I have no choice but to go to Australia because I can't be employed here. And I can't help but think that when you think about when those students entered study, right, in that kind of peak COVID period, nurses are heroes, nurses are essential workers, we value nurses, we clap for them in the street. And then by the time they finished the degree, there's too many nurses, we don't have a job for you, and we're not prepared to provide you safe working conditions or pay you fairly. And so there's this real kind of whiplash moment in how we value our health workers and value our nurses that I think is only putting them on a plane to Australia.
So just to recap at the end of this, slightly terrifying interview, we've got a nursing workforce that's overworked, where you have many days where you don't have enough staff. However, there's too many nurses for the budget. The Ministry of Health has decided that it's going to fix this problem by trying to save exactly the amount of money that it's been given in new funding this year. At the same time, the Ministry of Health is offering nurses real terms pay cuts as a solution to understaffing, as a solution to nurses leaving the country. And to compound this, the Minister for Health is perhaps being economical with the actuality when it comes to what is really happening with nurses' pay. This seems like a fairly toxic situation. What's the best way out of this?
I think in the immediate term, it's coming back to the table in good faith to meet these particular nurses and to acknowledge the burnout and the difficulties in providing care to patients in the health system, and to focus on the staffing aspect. And to value nurses adequately in terms of negotiating a cost of living increase. I think more broadly, it's about resetting sustainable levels of funding into the health system, and to do adequate workforce planning where we have rigorous pipelines to train our own workforce to provide clinically safe, culturally safe, tatility-based care to all people when and where they need it. And I think kind of having these short-term band-aids on just trying to keep the system limping along is only going to lead it to further breaking point, really, and allowing that further encroachment again of private services. And I know that opens up another big kettle of worms, but looking at how we genuinely deal with things like unmet need, lengthy wait lists, high turnover of staff, burnout among our health workforce, they're big problems, and they require that kind of political courage, I think, from both the people who are leading the health system in terms of its direct engagement with workforce, but also the people in the room making bigger decisions about funding, need to be prepared to stand up and genuinely say that they want to have a viable, equitable, accessible public health service.
Nathalie, thank you so much for the information today. I mean, it's been, as I say, I usually finish my shows by saying, I hope you found it in parts, maddening and in parts enlightening. But you've definitely brought that to the table today. So thank you. When is industrial action likely to happen in New Zealand with nurses?
So the 30th of July, nurses will begin a 24-hour strike across all parts of the motu. And then from there, we'll kind of see where we're at. But yeah, the 30th of July is planned industrial action.
Well, best of luck to you and everybody inside NZNO. You have all the support of everyone here at Locked Out. And knowing that, health is now the second most important issue to voters in the country. It seems increasingly that the public is behind you as well. So thank you so much for joining us here today. And I hope we can talk in better times soon.
Absolutely. Thank you for having me, Craig.
Now for the section of the show where we look at the numbers making the headlines in New Zealand. And first of all, last week, we showed you a chart from the Reserve Bank, which for the first time demonstrated that the Reserve Bank, what it calls Kiwi GDP, or now forecast for the economy, was that the Reserve Bank was forecasting that we were actually heading back into economic decline. The economy was shrinking. Now, since then, there's been an update of that chart with another couple of weeks of data, and unfortunately, it's got worse. We've gone from a 0.2% fall to essentially a 0.3% fall. It looks increasingly likely that the economy is heading back into not a recession. A recession is 2 quarters of negative growth, but certainly less economic output, slower economy, and one where the jobs and economic growth are going to be much harder to come across, despite all the claims that we're getting back on track. We're also seeing in this data that the performance of services index data is showing that services, again, aren't growing. The performance of services index declined again. The performance of manufacturing index, again, declined again. Both showing scores below 50, which means less economic activity, less economic output. We also saw, finally, migration data. And this, again, is particularly important given the conversation we've just had with Nathalie about nursing. We're now losing a New Zealander, a New Zealand citizen, every 7 minutes and 24 seconds overseas. We saw record out migration from New Zealand citizens, and we're very close to now being an active net exporter of population. We're still net currently bringing in a very small number of people, but it's well below historic trends, and it's well below the numbers to keep the economy moving. What that means, again, that's not supporting economic growth. We're seeing people with skills leave the country. We have approximately 15,000 fewer people who are working in New Zealand in construction right now, and we all know where they're working. They're in Australia, they're overseas. Again, that Reserve Bank data, it's telling us what we all know, what the other forecasts are all telling us. The economy isn't moving, and we've got to do something to help move that, to help make it go a bit faster, to invest in New Zealand, and to not take the medicine that the budget, unfortunately, is doling out. Well, thank you so much for joining us here on the podcast. We always welcome you here. We hope you've found it in parts maddening and in parts enlightening. If you've enjoyed the show, please give us a review or a recommendation on YouTube, Spotify, or wherever you download. Locked Out looks forward to talking more with you next week. Don't work too hard. Goodbye.